So, under normal circumstances, no, a few air bubbles or a little bit of air in your IV line will not hurt you. Movies have people thinking that one tiny little air bubble is going to end it all. In reality, again, under normal circumstances, it would take about 60 cc's or 6 of these syringes filled with air pushed in really fast to harm the average person. There are actually even some diagnostic studies where we purposely put air bubbles into your veins, and that's called a bubble study or a bubble echocardiogram. IV lines usually have bubble traps anyways to prevent any air bubbles from getting into your vein. But if any air bubbles do get into your vein, they'll travel to your heart where the pulmonary artery will take them to the lungs and they'll just be reabsorbed by the alveoli. Now, I'm not saying you shouldn't prime your line or try to get all of the air bubbles out. I'm just saying it's not the end of the world if a couple air bubbles do get in. Now, if an air bubble gets into an artery, then we could have a problem. For example, if your patient has a heart defect such as a patent foramen ovale, which is a hole between the left and right sided atria of the heart, the air bubble could completely skip the part where it goes into the lungs to get reabsorbed, and it could go into an artery where it can travel to your brain, and that's no bueno. An air bubble in an artery is called an arterial air emboli. These emboli can travel to your brain, heart, or lungs where they can cause a stroke, heart attack, or respiratory failure. So while an air bubble that makes its way into your artery can be harmful, the ones that go through your IV are usually harmless. But again, there's always exceptions and there's always anomalies, so take that information with a grain of salt.